Hello all, welcome to today's video. Today we are going to talk about low back pain in pregnancy. Did you know that almost 67% of women experience low back pain when they are pregnant? I myself have 2 daughters and I have experienced low back pain when I was pregnant, so I completely resonate with you if you are one of them who experienced low back pain at this point. While there may be many causes of low back pain, the most common cause is the change in your posture and the resulting tightness that may happen in your muscles and ligaments due to the increasing size of your belly and your uterus. So in today's video, I'm going to teach you simple yet effective exercises and the stabilization method so that you can deal with low back pain during pregnancy to make sure that pregnancy is a beautiful experience, not a painful one. If you would like to learn more about pregnancy and any pelvic related diagnoses and how to expedite your recovery, I would like you to stop the video right here, pause it and try to subscribe to our channel and hit the bell icon as well. That way you get notified anytime I put up a next video with the latest content. I try to do it once every week, so hit that bell icon right now. My name is Dr. Amruta Inamdar. I am a pelvic floor rehabilitation specialist. That means a physical therapist specializing in pelvic floor dysfunction. To date, I have seen thousands of patients with various pelvic floor diagnoses, and back pain during pregnancy is one of them. If at this point you are suffering from low back or pelvic pain related to pregnancy, you are struggling with when to start, how to start with your exercise program, I want you to stop this video, pause it right now and try and comment on this video. That way I would get a chance to answer to each and every one of your comments. I would like you to tell me what exactly you are struggling with and whether you have experienced back pain related to pregnancy and how you helped yourself to deal with it. So do you have pain related to pregnancy which lingered even after? Answer with a simple yes or no. In my career as a pelvic floor physical therapist, I have seen several women suffer from low back pain related to pregnancy which starts off during pregnancy and just lingers on even after. The American Pregnancy Association has quoted that around 70% of women who are pregnant experience low back pain during the pregnancy. Many times, not doing exercises or doing incorrect exercises is the common reason why you're suffering from low back pain. So let's begin learning some good exercises for your pain. Before we begin our exercises, just a quick reminder and warning because you are pregnant. If you have sudden onset of pain, unremitting pain, or cramp-like sensation associated with bleeding or spotting, you are not supposed to do any kind of exercise. Go and talk to your doctor. Before you begin any kind of exercise regimen, I would highly recommend that you see your OBGYN and get clearance for exercise before trying any new exercise after your pregnancy has begun. The first technique we are going to learn is how to stabilize your pelvis. Now when you're pregnant, there's a hormone called relaxin that starts getting secreted in the first and the second trimester and it shoots up in its level in the third trimester. Okay, so what basically is relaxin? It is a hormone that gets you ready for birth, right? It causes your joints and ligaments and basically the joints to get looser. Alright, so look at the pelvis just to quickly understand. This is your uterus which is going to grow in size as you get pregnant, right? Now the bones sit so close to the uterus, and because of the growing uterus, this bone in the center called the pubic symphysis may get strained or it may start moving more than it is needed. That is the whole reason why we need to stabilize the pelvis. Now I'm going to teach you exactly how to stabilize so that you can get like an effective result. There are many pelvic stabilizers on the market. My favorite is Serola. So I'm going to drop in a link in the description. Check it out. You could choose to purchase whichever is best for your budget, but you want to make sure that you make a good choice. Now right now I do not have the Serola with me, but I'm going to show you how exactly to stabilize and where to stabilize. So what you're going to do is you're going to take the base of the belt and you're going to first flex your hip, right? So when you flex your hip, this is the level at which you're going to keep the base ring. Okay, so let me show you. So many times in the clinic I've seen women trying to put the belt here, and then it absolutely doesn't work. So you have to remember that the pubic bone that we just saw in the model is way down, okay? So you have to stabilize it at the level of your hips. So this is where your stabilizer is going to go. The base of your stabilizer has to be snug, okay, and the belt that you're going to wear above it could be moderately snug. In the first exercise, we are going to talk about how to effectively mobilize the joints of your pelvis. When you are in severe pain, you want to be aware that the mobility, the movement in your pelvis is not hampered. The muscles, if they are under stress or if they are too tight, may affect the mobility. So that's why we are going to focus on the first mobility exercise. So you're going to lie down on your back. Okay, you have to make sure that you do not get any dizziness or any discomfort as you lie down. Okay, if you do get discomfort, you would make sure that you do this exercise on a more reclined surface, okay, or basically skip it. Alright, so you're going to lie down on your back. So now you're going to start by bending both your knees. Alright, now the first step is to try and feel both your hip bones, and you're going to try and do an anterior pelvic tilt. That means you're going to try and arch your back, and you're going to try and flatten your back. Okay, let's try and do it two to three times more. You're going to arch your back and flatten your back. Make sure you feel like a nice mobility in your pelvis, especially in this area. One more, arch. You see how there's a gap there? That means you're arched, okay? And you're going to press down gently. That's flattening, okay? Now this is the first variation. Now the next step would be to raise the side of your pelvis up. Okay, so it's almost like a dance move but in the lying down position. Okay, so you're going to go up with the left, relax, up with the right, relax. When you do this movement, you will feel all the joints of your pelvis moving beautifully. Okay, so up with the left, up with the right. This is your first exercise which will improve the mobility of your pelvis. So the second exercise we are going to learn is also in the lying down position. Alright, now this exercise is going to focus on more stability, okay, more strength to your pelvis. Alright, so we are going to use the big stabilizer muscle, that means your gluteus muscle. Alright, now you're going to couple your pelvic floor strengthening exercise or your Kegel exercise with a bridge. Okay, so if you want detailed instruction on how to do a Kegel, please click on the link that has been listed on the top of the screen. That way you get to see in detail how to do a Kegel. I want you to pause the video right here, go back, check that other video, and then come back to this video. Alright, so now I'm going to assume here that you have looked at that video and you know how to do a Kegel. Okay, so you're going to inhale, exhale, draw in your pelvic floor, stabilize the deep core muscle here called transversus, and you're going to hold your Kegel at the best of your capacity. Now the next step is to slowly raise your hips up trying to feel for your glute muscle. Hold 1, 2, 3, 4, 5 and gently put it down. Okay, the way to make sure that your glute muscle recruits and no other muscle compensates for your glutes is by doing this trick. Follow carefully. Okay, so you're going to inhale, exhale, recruit your pelvic floor. Now when you try to raise your hips up, I want you to translate. Try and move your knees towards your feet and gently push down with your elbows. So let's try that. You're holding your Kegel while you push up. Hold 1, 2, 3, 4, 5 and gently put down. Make sure you feel it only in your glutes. No other muscle is allowed to work during this exercise except the pelvic floor. Okay, let's do it one more time. Inhale, exhale, draw in the pelvic floor, stabilize the core, raise your hips up while pushing your elbows down, knees try to move towards your feet. Feel your glute muscles stabilize. Hold 1, 2, 3, 4, 5. This also is a relieving position because your downward pressure because of pregnancy is relieved when you raise your hips up. Now in this next exercise, we are going to go in the all four position. Alright, that means on your hands and your knees. This is an extremely relieving position. So let's go in a hand and knee position like that. You want to make sure that your hands are aligned under your shoulders, both hands, and your knees should be aligned under your hips. So you should not go like this or like that. Okay, so exactly under your hips. Make sure you're bearing equal weight on both your legs. Alright, so now when you're pregnant, you are basically living in this position, right? Because of the weight of the belly, right? So now in this exercise, we are going to try and neutralize the spine. What does that mean? That means you're going to draw in the belly. Okay, so let's practice this. Let's begin. Try to draw in the belly. Hold 1, 2, 3, 4, 5 and drop. And one more. Try to draw in the belly. Hold 1, 2, 3, 4, 5 and drop. Now let's try and incorporate a little Kegel when you do the same movement. Alright, so you're going to inhale. Do this with me. Inhale. Now exhale. Draw in the pelvic floor, so you should feel like a drawing in of the pelvic floor, and now simultaneously take the belly in and let go. Let's practice this once more. Okay, do this with me. Inhale, let the belly relax. Exhale, draw in the belly, arch the back, slightly draw the belly, draw the baby up. That's the easiest clue I use. Draw the baby up. Hold 1, 2, 3, 4, 5 and relax. So when we are pregnant, especially in the third trimester, towards the end of the pregnancy, because your belly is growing, there's kind of a compressive force that happens on the backbone here, or the sacrum. Okay, so there are several ligaments that attach to the sacrum that are kind of, they're compressed, and that is one of the main reasons why you have back pain in pregnancy. Okay, so in this stretch that we are going to learn, we are going to target exactly that. So what I want you to do is, you could do this, try this with me. Face your side and you're going to try and sit on folded knees. Make sure there's no pain in your knees, otherwise you could choose to keep a pillow in between. Now you're going to open your legs out as wide as you can go. Alright, sit up tall. Now I don't have a belly right now, but you do. So there's a belly here, right? So you have to make sure that you are completely comfortable. Now if you are in the first or the second trimester, you are going to be able to do the exercise the way I'm going to show you right now. If you are in your third trimester, you are going to stack up pillows here so that you don't have to go on the floor completely. Okay, so let's start. So you're going to sit with legs out. Now you're going to raise both your arms up. Take a deep inhale. As you exhale, you're going to hip hinge forward, hip hinge forward. Try to let your hands slide down on the floor. Okay, make sure your hips are back on the feet and try and feel the stretch. Inhale. Do some belly breathing here. Exhale. Do a gentle Kegel and let go. One more inhale. Belly breathing. Exhale. Do a gentle Kegel and let go. Now you're going to slowly walk up, and that's it. There you go. You have the best 5 exercises that will help you relieve your low back pain during pregnancy to make sure that your pregnancy is indeed a beautiful experience and not a painful one. Feel free to reach out to me with any questions or comments about these exercises, as these videos are for you. Please tune in for our next video that I would be uploading next week. Do not forget to subscribe to our channel. That way you get notified about the latest videos and information that I'll be sending out. Until then, goodbye.